This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're in a place we hope you never have to visit, but it's here in case you need it. It's the emergency room. Now we're going to be speaking with Dr. Carrie Ahrens. She's an emergency medicine physician. We're going to be speaking about different types of stroke and a new program they have. It's called the Telestroke program. And the stroke team here in Oshkosh, combined with the docs on the other end, can make the difference between life and death. Well, thank you for taking some time with us today. We're going to be talking about the Telestroke program and some new technology that you have to deal with stroke patients. But before we get into that, I'd like to just ask you a little bit about strokes. What type of strokes are there?
Sure, good question. So two types of strokes. There is the bleeding stroke, and then there's the blockage stroke, where there's actually a blood clot that lodges into the artery of the brain. Those are the types of strokes. The blockage stroke, that Telestroke actually helps us to treat and fix, if we can fix them.
Right. And there are different, you mentioned different types of strokes. Why is it so important for the community to be educated on strokes, or maybe, you know, kind of diagnosing what a stroke, when a stroke is happening?
Right. Very important because it's very time sensitive. If you have a diagnosed stroke, or if you have a stroke finding, weakness on one side of your body, numbness on your face, confused speech, the amount of time between the start of those symptoms and actually getting treatment is huge. If you wait until the next day, I can't treat that much of the time. If you come within 3.5, 4.5 hours of symptoms, we can often treat that, and if I can't, then my colleagues, Dr. Darkabani, who is the gentleman who works with Telestroke, can.
Yeah. And saying that, if you think you're having a stroke or you think somebody else that you're near is having a stroke, what should they do at that point? At
that point, if you're afraid someone's having a stroke, you call 911. Sometimes, depending on the type of stroke someone is having, they could stop breathing or get very sick very fast, and you want to have the paramedics who can help stabilize their airway or keep them stable until they arrive. Plus, when you do an EMS send for a stroke call, we have it as a system lined up ready to go. It's almost kind of like a NASCAR team of sorts, where when they arrive, the patient goes to CAT scan. It is so much more efficient and much faster treatment when patients come by ambulance than when they choose to come by private car.
And again, time is so crucial when you're talking about a stroke.
Very crucial, very crucial. Again, we have 4.5 hours from the last known well time. So when was the last time that grandpa was acting normally or didn't have a facial droop? That's where we start the clock. And we only have 4.5 hours to give an IV clot buster called TPA. And that is all we have. Now, Dr. Darkabani, the neurointerventionalist who works with us on Telestroke, he has a bigger window and he can kind of pick and choose based on symptoms whether or not a patient could be given TPA or he can go and do a procedure on them. But that's his ability, which is why Telestroke is such a great tool for us. It adds on to that time.
Okay, you mentioned Telestroke, but now let's dig deeper into that right now. This is a beautiful looking piece of machinery here, and it's brand new here. Why did you get Telestroke here at Aurora?
Right. Well, the heart and stroke of Telestroke is Zaid Darkabani, Dr. Darkabani, the neurointerventionalist, neurologist, who actually brought this technology with us from his prior practice location in South Dakota. And he found out that this piece of machinery, which is worth thousands of dollars, is HIPAA compliant, and it also allows him to do an examination on a patient from anywhere. He could be on vacation in Florida, and we could call him up and say, hey, can you look at this patient? He doesn't do that now because he's the only guy who can pull the stroke clots out. But basically what we do is this machine can allow him to see the patient from wherever he is stationed, whether it be in Green Bay, and he can do an exam. He can focus in on the eyes using a special micro camera. He can do a full neurologic exam from wherever he is, and then decide, help us to decide, do we give TPA or not?
Which is
that clot busting drug. Okay. Exactly. And or if he just wants us to send the patient by helicopter up to him in Green Bay, where he can actually physically pull a clot out using special micro tools.
Mm-hmm. So this has cameras. He can see what's happening to the patient. He's actually looking at the patient, helping you to make a diagnosis on it.
Exactly, and interacting with the patient as well, and with myself. And there are very few strokes where there's some of them, if you get into that point of 4.5, 5 hours, and we're not really sure if the risk of a TPA clot busting drug is worth the benefit of it, where we really need him to weigh in and say, should we give this or not? Are we putting this patient at risk? More so than we're going to give them a benefit. And he really helps us to determine that, given his specialized training in neurology and stroke in particular, which is one of his passions. So it really helps us to make sure that the patient comes first. Patient safety is part of the oath we swore on upon graduation day in med school. And this is what helps us to provide that higher level of care fast.
And again, it all goes back to how sensitive the time issues are with a stroke patient. Is something like this, access to Telestroke, always available?
At this facility, it is always available both for ER patients and hospital floor patients, because people don't warn us when they're going to have a stroke. It just happens. And so he's available 24/7. We have other neurologists who are coming on board, but basically this system is now live 24/7. Whenever we need someone, they're there.
Yeah, and since it's here at Aurora in Oshkosh, how does it benefit the community?
Benefits the community because previous to this we have fantastic neurologists, but neurology is a huge, broad specialty, and they specialize in different things, and not necessarily specializing in stroke. And so you could call a neurologist to come in, and they're very helpful because they're very knowledgeable, but sometimes they couldn't come in because some of them are covering 2 different hospitals at the same time. This helps us to make sure that the patient comes first, not allowing schedules to be a block to them getting the care they need as fast as we can get it done.
It seems like an amazing piece of equipment, saving lives and also saving quality of life.
Yes, and that's exactly. The National Institute of Health and CDC have discovered that people who survive stroke have more of an issue than those who don't, because after survival of stroke, what's the morbidity? Meaning, can you still do your activities of daily living? Can you make dinner? Can you help yourself go to the bathroom? Things that we take for granted because we have function of all hands and feet. They may not have that. The faster we give TPA, the higher the likelihood is that they get back their normal activities of daily living at where they were before they had their stroke.
All right. Well, it's an amazing piece of technology helping you guys here at Aurora and Oshkosh.
Yes.
We appreciate you taking some time with us today.
My pleasure, and thank you for making this a highlight for the community, because it's very important.
Now, if you think you're having a stroke or somebody nearby you is having a stroke, best to call 911 immediately. And if you're looking for more information on the signs of stroke, you can always call your primary care provider. Give us a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.